Hey guys, Dr. Brotsky here. Welcome to your 37th week. Are you tired of being pregnant yet? The good news is you are early term, so that's very, very reassuring that you've gotten this far in your pregnancy. Things you can expect are basically more of the same that I've discussed in the third trimester. So this baby is just gaining weight and getting heavier. You're probably getting more uncomfortable. It's becoming more difficult to sleep comfortably in a position at night. You may be tossing and turning as well. So those things are very common, also more pelvic pressure, more swelling in your legs as well. From a doctor's perspective at 37 weeks, I'm usually checking patients every week for signs of labor, making sure all their questions are answered, and that if there's any suspicion of leaking fluid that we address that as well. Your doctor is going to be checking your blood pressure and the protein in your urine as well, more consistently every week at your appointments. At this point in pregnancy, 37 weeks, we sometimes will recommend induction for more high-risk patients. We don't routinely do this. We want you to have your baby at 39 or 40 weeks. That's the safest thing for you and your baby. But sometimes the risks of that outweigh the benefits of delivering early. So some patients with high-risk conditions such as high blood pressure, diabetes, or with fetal growth issues can sometimes benefit from delivery that's a little early. So that's why some patients do get delivered around this time. Although, like I mentioned, it's not our favorite time for you to have a baby. Those extra couple weeks make a lot of difference. Things that you can be doing right now are watching for any vaginal bleeding. Although you may notice that after your doctor checks you that you have some spotting, it shouldn't be heavy, it shouldn't be a flow at all. So if it is, go to the hospital. And call your doctor, let them know if you have any bleeding at all. Always look out for leaking fluid, like especially watery fluid, and look out for rhythmically painful contractions. I always tell patients if everything else is fine and you just start contracting every 10 or 15 minutes, wait those out. They'll eventually decide whether they're going to go into labor or not. So you'll get to where they're every 5 minutes and you can go in, or they'll just stop and you'll be happy you waited. Also at this point, just make sure you're aware of what your group B strep culture was. Sometimes things happen. Sometimes you have an emergency and you end up not delivering at the hospital, or maybe they can't get a hold of the lab to get the result. So it's useful for you and for the nursery to know that, hey, my group B strep is negative, so that they can just use that as an extra layer of reassurance. That's it for week 37. Thank you so much for watching this video. Check out the rest of them as well, and you can find me at drbrotsky.com.